Zenker's diverticulum. So first we discuss about diverticulum. So there are two main types of diverticulum, true and false. So true diverticulum has all three layers of gut wall involved, which results in outpouching. And the example is Meckel's diverticulum. False diverticulum is caused by outpouching of mucosa and submucosa only into the area of weakness. So all three layers are not involved. No muscularis externa. So example, if the diverticulum is present in esophagus, stomach, duodenum, colon. What is the most common location of diverticulum? False diverticulum, most common location, sigmoid colon. This is the most common location of false diverticulum. Let's discuss about Zenker diverticulum. It is present in upper esophagus, so it's a false diverticulum. Exact etiology is not, exact pathology is unclear. Sometimes some people say that esophageal dysmotility, esophagus is not contracting properly, that results in herniation. Herniation occurs at the point of potential weakness between cricopharyngeal muscle and thyropharyngeal part of inferior pharyngeal constrictor. You need to know these two muscles because they can ask you in the exam. Between cricopharyngeal and thyropharyngeal part of inferior pharyngeal constrictor. This and this muscle is important. It commonly happens between these two. So we have esophagus, and then we have diverticulum like this. Esophagus goes down. So whenever patient eat, the food will chronically regurgitate into this pouch, stay here for a few days, and this will actually put pressure on the esophagus and compress it. When this happens, that will cause dysphagia. Because food is staying here, that can cause halitosis, bad mouth, regurgitation of food through the mouth. Food can go here, food can go up, go into the larynx, can cause aspiration. Patient will feel like neck mass. So treatment is surgical.